Neuroscience has shown that for the last 20,000 years, the human brain has stayed approximately the same despite the huge variety in existing phenotypes. This is true for genomics, epigenetic programming, and neuroanatomy, as well as hormonal responses along the stress axis and the high variety of neurotransmitters. For example, the serotonin receptor is at least 400 million years old, and the neurotransmitters involved in stress responses have a genetic sequence that can be tracked back to over 500 million years. Across both time and species, our hardware, the brain, has remained essentially unchanged. Mental disorders are still considered to be brain disorders or anchored in neurobiological process. Philosophers call this a machine paradigm or an eliminative materialism, where we look at mental states from outside and deduct all mental states from material ones. The Journal of the American Medical Association in Psychiatry echoes this view. The diseases that we treat are diseases of the brain. But does that mean that we have to treat the brain in order to heal mental health disorders? Could it be that the brain is just the final pathway in a long series of events originating outside the brain, which require more attention, understanding, and which are potentially more relevant than findings within the brain itself? Second, there is a materialistic bias that doesn't take into account the realm of spirituality in medicine. In fact, the level and the degree of consciousness widely determine the psychopathology and the overall diagnostic and therapeutic procedure. Third, there is increasingly robust evidence to demonstrate that our mind evolves in steps and levels, and that the ego functions and their associated psychopathology are not the last steps in this overall development. Fourth, for the first time in medical and psychiatric history, we have access to wisdom from around the world, as well as from all historical epochs which use different models, approaches, and understanding of patients' signs and symptoms. Because nobody's 100% wrong, a helicopter view is needed to adequately embrace the complexity of viewpoints and interpretations. Fifth, if we only have a hammer, everything we see is a nail. If different tools and perspectives become available, the world is no longer limited to being a nail to a hammer, meaning if we only have drugs and psychotherapy available for treatment, we only see the impact of drugs and psychotherapy. We ask what we know, diagnose what we see, and treat what we are familiar with. In short, psychiatry is extremely theory sensitive. If we change the theory, then we change almost everything. Sixth, in order to increase our knowledge of mental disorders involving the human brain, the vast majority of experiments, whether they be molecular, animal, clinical, or social, are designed as so-called randomized controlled trials, RCT. And indeed, the RCT design is held as the gold standard in evidence-based medicine. Using this method, large amounts of data with significant results are generated. However, most data are unspecific, controlling against healthy animals, healthy subjects, normal populations, or standard environments produces results in the investigation arm that do not necessarily lead to specific insights into specific components. Based on a PubMed search of clinical trials in July 2018, roughly 600,000 published trials were retrieved in which less than 5 had a control group. Within this 5% of controlled studies, only healthy subjects were used as a control group. Another design focused on improving the specificity in psychiatry or the development of new forms of interventions is necessary to improve the understanding of mental disorders. This would require a control group which includes other mental disorders to increase the specificity in psychiatric research. CAM means complementary alternative treatments are often unspecific and work by promoting self-healing capacity and self-efficacy of individual patients. CAM is an unspecific but powerful tool to improve the overall mental health status in patients. It has the capacity to increase cognitive reserve and resilience because most interventions are primary and secondary preventive by nature. There are several reasons why CAM, complementary alternative medicine, is needed. First, conventional psychiatry has a limited evidence base. Clinical practice in psychiatry is only 25% based on empirical scientific evidence. Additionally, 90% of clinical studies are sponsored by industry. Only 50% of conducted studies are published, and out of these 50%, two-thirds are the object of ex post changes in outcome parameters, according to a study of New England Journal of Medicine in 2015. Lastly, 90% of the sample populations used to do not match the clinical reality in day-to-day work with regard to comorbidities, severity, and socioeconomic status. We are simply thus left with only a small database of relevance for clinical management. Second, there is limited patient adherence for most long-term psychiatric therapy. Compliance and adherence rate for patients in long-term psychiatric care is less than 50% in patients with mental disorders. In the German population, more than 40% of patients with mental disorders have more than 4 drugs, which can lead to multiple side effects and drug-drug interactions. Third, beyond the standard of care in conventional psychiatry, CAM guidelines and recommendations from professional medical associations can positively impact side effects, costs, clinical outcome, patient safety, and satisfaction. Fourth, there is greater compliance and reduced costs with the use of CAM. CAM is additive and complementary to baseline standard of care given in psychiatry. Many patients proactively request CAM treatments to reduce side effects and costs and offer a more personalized, patient-tailored, and stepwise approach in mental disorders. Fifth, there is a thumb rule. The more chronic, the more functional, the higher the stress level, the higher the comorbidity load, and the more personalized the clinical conditions are in psychiatry, the more important it will be to use a conventional and complementary integral approach. The opposite is true. The more acute, organic, and severe the psychiatric conditions is, the better conventional psychiatry becomes at treating it. How to do it? Founded in 1870, the Chadras Hospital is standalone, not-for-profit hospital offering round-the-clock inpatient care for all mental and neurological disorders. It is a teaching hospital accredited for the full 5-year EU-certified psychiatric training program based on German guidelines. It is affiliated with several academic university hospitals to carry out clinical trials in complementary alternative medicine. In terms of patient care, the hospital has 120 acute inpatient beds. Over 2,000-5,000 inpatients per year are treated, and the average inpatient stay is 24 days. Additionally, there are 80 outpatient beds in 4-day clinics. The outpatient clinics have over 50,000 outpatient contacts per year, including subspecialty outpatient clinics for non-tumor pain, addiction medicine, dementia, personality disorders, as well as trauma-associated disorders. In terms of complementary alternative medicine, it is one of the largest hospitals providing integral mental health care in Germany. An average of 15 CAM interventions per patient per inpatient stay are provided. These include patient-tailored physical exercise and yoga programs, diet changes, supplements, herbal therapy, hydrotherapy and pads, homeopathy, acupuncture, neural therapy, aromatherapy, guided meditation, healing touch, and osteopathy, among others. For over millions of years, humans have lived in groups, depending on direct social contact, being exposed to the natural circadian rhythm of day and night and to differences in temperature, have eaten non-processed food, being physically active for 4 to 6 hours per day, and being exposed to nature. The past 2 to 3 generations have progressively lost contact with these so-called pillars of health. We now spend most of the day sitting, eating a higher proportion of processed food, interact through digital social media at the expenses of face-to-face contact, are surrounded by buildings and confined to being indoors, where permanent lighting dampens our day and night rhythm, while heating and cooling systems prevent us from changes in temperature. This shift is key to understand the chronicity, prevalence, and morbidity in mental health. Irrespective to the technological know-how we discover in the future, the insights of complementary alternative medicine can provide us access to the internal wisdom of health. There is a treatment philosophy in place which takes into account the sequence of treating patients with mental disorders, starting with symptom control onto promoting a self-healing capacity in order to achieve greater balance. The use of CAM is targeted to achieve just these results. The Hippocratic Oath in medicine states nihil nocere. This involves 2 components: avoiding mistakes that are known, but also avoiding those we ignore. Integral medicine, which combines conventional medicine and CAM, tries to avoid both. By combining the best of each medicine, this integral, non-reductionist approach makes an added difference. From a bio-psychosocial to an integral model, it is what will determine the psychiatry of tomorrow.